Ever wondered if your liver is trying to tell you something? What if simple signs like unusual fatigue or changes in your stool color are your body's way of sounding the alarm? In this video, we'll reveal the key signs that your liver might be struggling and what they mean for your health. Stay tuned to discover how to spot these crucial warnings and take action before it's too late. Let's dive in. First sign on our list is jaundice. Jaundice is a noticeable sign that the liver may not be functioning properly. It is characterized by a yellowing of the skin and eyes, which can be quite alarming if you notice it in yourself or a loved one. The yellow color comes from bilirubin, a substance produced when red blood cells break down. Normally, the liver processes bilirubin and helps it be eliminated from the body. However, when the liver is not working properly, this process is disrupted. The liver plays a crucial role in processing bilirubin. It takes bilirubin from the blood, breaks it down, and then excretes it through bile. When the liver is damaged or diseased, it struggles to perform these functions. As a result, bilirubin builds up in the bloodstream, causing the yellowish discoloration associated with jaundice. Several conditions can lead to jaundice. One common cause is liver inflammation, such as hepatitis, where the liver becomes swollen and unable to function properly. Another cause can be liver cirrhosis, a condition where the liver becomes severely scarred from chronic damage. Both conditions interfere with the liver's ability to process bilirubin effectively. Jaundice can also occur when there is an obstruction in the bile ducts. The bile ducts are responsible for carrying bile, which contains bilirubin, from the liver to the intestines. If these ducts become blocked, bilirubin accumulates in the liver and bloodstream, leading to jaundice. This can be caused by gallstones or tumors that obstruct the bile flow. In addition to liver diseases, jaundice can also be a sign of other issues, such as hemolytic anemia. This condition involves the rapid breakdown of red blood cells, leading to an excess of bilirubin that overwhelms the liver's capacity to process it. The result is a buildup of bilirubin in the bloodstream and subsequent jaundice. Next sign on our list is abdominal pain and swelling. Abdominal pain and swelling can be key indicators that the liver is not functioning properly. The liver is an essential organ that performs numerous vital functions, including detoxifying harmful substances, producing bile, and regulating metabolism. When the liver is compromised, it can lead to various symptoms, including pain and swelling in the abdominal area. One of the primary reasons for abdominal pain and swelling is liver inflammation. When the liver becomes inflamed, a condition known as hepatitis, it can cause discomfort and pain in the upper right side of the abdomen. The inflammation can lead to swelling in the liver, putting pressure on surrounding tissues and causing discomfort. Another reason for abdominal pain and swelling is liver cirrhosis. Cirrhosis is the result of long-term, continuous damage to the liver, which causes scar tissue to form. This scar tissue disrupts the liver's normal structure and function, leading to increased pressure in the liver's blood vessels. This pressure can cause fluid to leak into the abdominal cavity, resulting in swelling, also known as ascites. In cases where the liver is not processing toxins effectively, the accumulation of these toxins can lead to discomfort and pain. The liver's role in filtering out toxins is crucial for overall health, and when this function is impaired, it can cause systemic issues, including abdominal pain. Obstructions in the bile ducts can also contribute to abdominal pain and swelling. The bile ducts are responsible for transporting bile from the liver to the intestines. When these ducts become blocked, bile can back up into the liver, causing it to swell. This obstruction can lead to pain and discomfort in the abdominal region. Additionally, liver tumors or growths can cause pain and swelling. As tumors develop, they can increase the size of the liver or press against other abdominal organs, leading to pain. If the tumor obstructs bile flow or causes inflammation, it can further contribute to swelling in the abdomen. Fluid accumulation in the abdomen, or ascites, is a common consequence of liver dysfunction. When the liver is not functioning properly, it can lead to increased pressure in the blood vessels and a decrease in the production of proteins that help retain fluid in the bloodstream. This imbalance can cause fluid to seep into the abdominal cavity, leading to noticeable swelling. Monitoring abdominal pain and swelling is crucial for identifying liver problems early. If you experience persistent or severe abdominal discomfort and swelling, it is essential to seek medical evaluation. A healthcare professional can perform diagnostic tests to determine the underlying cause and recommend appropriate treatment to address liver dysfunction. Next, we have dark urine. Dark urine can be a significant sign that the liver is not functioning properly. Normally, urine ranges from light yellow to amber, depending on hydration levels and the concentration of waste products. When the liver is not working efficiently, it can cause changes in urine color that might indicate underlying health issues. One of the primary reasons for dark urine is the buildup of bilirubin, a substance produced when red blood cells break down. The liver processes bilirubin and excretes it through bile. If the liver is damaged or diseased, its ability to process and eliminate bilirubin can be impaired. As a result, excess bilirubin spills over into the bloodstream and is eventually filtered by the kidneys into the urine, causing it to darken. Liver conditions, such as hepatitis and cirrhosis, can disrupt normal bilirubin processing. Hepatitis, an inflammation of the liver, can lead to an overload of bilirubin in the bloodstream. Similarly, cirrhosis, a condition characterized by severe scarring of the liver, can hinder bilirubin elimination, resulting in darker urine. Another factor that can cause dark urine is liver obstruction, such as bile duct blockage. The bile ducts are responsible for transporting bile, which contains bilirubin, from the liver to the intestines. If these ducts are obstructed, bile can accumulate in the liver and spill into the bloodstream. This excess bilirubin is then excreted through the urine, giving it a darker hue. In addition to liver issues, dark urine can also be a result of dehydration. When the body is dehydrated, urine becomes more concentrated, which can intensify its color. However, if dark urine persists despite adequate hydration, it may signal an underlying liver problem that needs medical attention. Liver cancer or tumors can also contribute to dark urine. Tumors in or around the liver can affect bile production and flow, leading to an increase in bilirubin levels. This disruption can result in darker urine as excess bilirubin is filtered out by the kidneys. Monitoring changes in urine color can be an important part of recognizing liver issues early. If you notice that your urine is consistently dark, especially if accompanied by other symptoms such as jaundice, abdominal pain, or fatigue, it is crucial to seek medical advice. A healthcare professional can perform tests to determine the cause of the dark urine and assess liver function. Next, we have pale stool. Pale stool can be a telling sign that the liver is not functioning properly. Normally, stool ranges in color from light brown to dark brown, primarily due to the presence of bile, a digestive fluid produced by the liver. When the liver is compromised, it can lead to noticeable changes in stool color, which might indicate underlying health issues. One of the primary reasons for pale stool is a disruption in the flow of bile. The liver produces bile, which is stored in the gallbladder and then released into the intestines to aid in digestion and give stool its characteristic brown color. If the liver is not producing enough bile, or if bile flow is obstructed, stool can become pale or clay-colored. This can happen due to conditions such as hepatitis, cirrhosis, or bile duct obstructions. Hepatitis, an inflammation of the liver, can impair bile production and its release into the intestines. When the liver is inflamed, it may not effectively process or excrete bile, resulting in pale stool. Similarly, cirrhosis, a condition characterized by scarring of the liver, can disrupt normal bile production and flow, leading to changes in stool color. Obstruction of the bile ducts is another common cause of pale stool. The bile ducts transport bile from the liver to the intestines. If these ducts become blocked due to gallstones, tumors, or other conditions, bile cannot reach the intestines. This blockage can prevent bile from coloring the stool properly, causing it to appear pale or clay-colored. Liver cancer can also contribute to pale stool. Tumors in or around the liver can interfere with bile production and flow, leading to a decrease in the bile reaching the intestines. As a result, the stool may lose its normal color and become lighter or pale. In addition to liver conditions, other gastrointestinal issues might cause pale stool. For example, pancreatic disorders can impact bile production or flow, leading to similar changes in stool color. It's important to consider the entire context of symptoms when assessing health, as pale stool can be related to various issues beyond just liver problems. Next, we have chronic fatigue. Chronic fatigue can be a significant indicator that the liver is not functioning properly. The liver plays a central role in many bodily processes, including metabolism, detoxification, and energy regulation. When the liver is not working as it should, it can lead to persistent tiredness and a lack of energy. One key reason chronic fatigue occurs with liver dysfunction is that the liver is responsible for metabolizing nutrients and converting them into energy. When the liver is damaged or diseased, its ability to process nutrients effectively is compromised. This can result in insufficient energy production, leaving you feeling constantly fatigued and drained. Liver conditions such as hepatitis and cirrhosis can significantly impact its ability to carry out its functions. Hepatitis, an inflammation of the liver, can lead to symptoms like fatigue, because the liver's inflamed state interferes with its normal metabolic processes. Similarly, cirrhosis involves extensive scarring of the liver, which can disrupt liver function and contribute to chronic tiredness. In cases of liver failure, the situation becomes more severe. The liver's ability to filter toxins from the bloodstream is diminished, leading to a buildup of harmful substances. This toxic overload can affect various systems in the body, including energy levels, causing profound fatigue and weakness. Another reason chronic fatigue can be linked to liver dysfunction is the liver's role in hormone regulation. The liver helps metabolize and balance hormones that are crucial for energy levels and overall well-being. When the liver is not functioning properly, hormonal imbalances can occur, leading to persistent tiredness and a feeling of exhaustion. Additionally, liver disease can also impact sleep patterns. Conditions affecting the liver can lead to discomfort and pain, which may interfere with sleep quality. Poor sleep contributes to fatigue, creating a cycle of tiredness that can be difficult to break. Chronic fatigue can also be a sign of other complications related to liver dysfunction. For instance, ascites, the accumulation of fluid in the abdomen due to liver issues, can cause physical discomfort and a feeling of heaviness, which can further exacerbate fatigue. Recognizing chronic fatigue as a potential sign of liver problems is important for seeking timely medical advice. If you experience persistent tiredness along with other symptoms such as jaundice, abdominal pain, or dark urine, it is crucial to consult with a healthcare professional. They can perform diagnostic tests to evaluate liver function and determine the underlying cause of the fatigue. Next, we have unexplained weight loss. Unexplained weight loss can be a significant sign that your liver is not functioning properly. The liver plays a vital role in various bodily processes, including metabolism, nutrient storage, and energy regulation. When the liver is compromised, it can lead to unexpected weight loss and other related symptoms. Liver conditions such as hepatitis and cirrhosis can significantly affect its function. Hepatitis, which involves inflammation of the liver, can lead to reduced appetite and nausea. As a result, individuals may eat less, leading to weight loss. Similarly, cirrhosis, characterized by scarring of the liver, can also affect appetite and nutrient absorption, resulting in unintended weight loss. In cases of severe liver dysfunction or liver failure, the situation can become more pronounced. The liver's inability to process toxins effectively can lead to a buildup of harmful substances in the body. This toxic overload can cause various symptoms, including a loss of appetite and unintended weight loss, as the body becomes less efficient at utilizing nutrients. Another factor contributing to weight loss with liver problems is the liver's involvement in hormone regulation. The liver helps regulate hormones that control metabolism and appetite. When the liver is not functioning properly, hormonal imbalances can occur, which can disrupt normal eating patterns and contribute to weight loss. Last, we have nausea and vomiting. Nausea and vomiting can be significant indicators that the liver is not functioning properly. The liver is a vital organ responsible for various crucial functions, including detoxification, bile production, and metabolic regulation. When the liver is compromised, it can disrupt these processes and lead to symptoms such as nausea and vomiting. One primary reason for nausea and vomiting related to liver dysfunction is the liver's role in detoxifying the blood. The liver filters out harmful substances and toxins from the bloodstream. When the liver is damaged or diseased, its ability to effectively remove these toxins is reduced. As a result, these toxins can accumulate in the body and irritate the gastrointestinal tract, leading to symptoms like nausea and vomiting. Hepatitis, an inflammation of the liver, is a common condition that can cause nausea and vomiting. The inflammation interferes with the liver's normal function, which can lead to digestive disturbances and an upset stomach. This disruption often results in feelings of nausea and can trigger vomiting as the body attempts to expel irritants. Liver cirrhosis, a condition characterized by scarring of the liver tissue, can also contribute to nausea and vomiting. The scarring impairs the liver's ability to process nutrients and detoxify the blood, leading to a buildup of toxins. This buildup can cause gastrointestinal symptoms, including persistent nausea and vomiting. In cases of severe liver dysfunction or liver failure, nausea and vomiting can become more pronounced. The liver's inability to manage toxins and waste products effectively can lead to severe gastrointestinal symptoms. As the liver's condition worsens, these symptoms can intensify, making it difficult for individuals to maintain a normal appetite and digestive function. Obstructions in the bile ducts, which are responsible for transporting bile from the liver to the intestines, can also lead to nausea and vomiting. When bile flow is obstructed, it can cause a backup of bile in the liver, leading to an imbalance in digestive processes. This disruption can result in nausea and vomiting, as the body struggles to handle the excess bile. Additionally, liver cancer or tumors can contribute to gastrointestinal symptoms, such as nausea and vomiting. Tumors in or near the liver can affect bile production and flow, leading to digestive disturbances. The presence of cancer can also cause general discomfort and irritate the stomach, resulting in nausea and vomiting.